All right, so we are about to do this bilateral cosmetic upper lid blepharoplasty. And what I'd like to do now is give a little explanatory video about how we mark the upper eyelids. It's a super critical part of the procedure. It's as important as any other part of the procedure, including doing it, with the knife. Why? Because, you make these markings and that's your guideposts as to where you're going to remove the skin, where you're going to make the incisions. And after you make those marks, you inject with some local anesthetic. And when you inject with local anesthetic, obviously it distorts the upper lid a little bit, makes it look a bit different. And you better trust your marks because you're not going to be making judgments, once you've injected that local. You make the judgments before you inject that local. And what you can see here is the basic anatomy, okay? What we have here is, here's of course the upper eyelid, and you can see the crease is a little bit hidden now because over the years there's been more and more of this skin developing. It happens to all of us. And this is the skin that we wish to remove. And we remove the skin not just above the eye, but we have to remove this skin laterally a little bit. The incisions, there's two of them really. The first incision is, you see where that crease is? Right in there? That's where the first incision is. The upper incision, we make some judgments as to how much skin can we take off. And we do that by pinching some of the skin. We use the calipers to measure that skin. We do it very carefully. Once we decide where that amount of skin is, then we make an upper line. There's a lower line and upper line. It's kind of like roughly the shape of a football, right? That's a simplification. All right, so first off, I'm going to take my marking pen, and we've used many different marking pens, but actually a Sharpie is the best pen that we can find to make these marks. And we're going to make a dot on the upper eyelid, but the lower incision. And every now and again, I'm going to ask you to go ahead and slowly open your eyelid. Okay, and now close it again. And what am I doing? I'm confirming, okay, that this is in exactly the right position. And then out here, like I mentioned a minute ago, you have to take off some of this skin out laterally because otherwise it'll be hooded and it'll hang down. We don't want that. Now I'm gonna make kind of a clearer mark by connecting these dots. So there's the lower part of the incision. So you can see with our eyes closed, you can see that line is right in here in that lower crease. Now, as you know, you don't just make one line, you have to cut sort of an oval of skin out. So the question is, how much skin are we going to cut out? So we use this little pincer and we sort of get a sense as to how much skin we can remove. Now that I've made that judgment, I'm going to go ahead and make a mark. And now I'm going to connect that mark all the way across and form an upper incision. Great. And so we're able to have them, open their eyes as well and look at those marks with eyes closed and eyes open. That's sort of a demonstration of how we mark the skin. We don't want to take an excessive amount of skin off and sort of start to get into a zone where you could precipitate dry eye. We want a very natural look. We want a very nicely healed incision. And so we want a great cosmetic result, but ultimately we need perhaps just a tiny bit conservative to make sure, we've all seen stuff in the media about media personalities that have gone too far, and it's difficult to come back from going too far. So that looks great. So the next step is we'll go ahead and inject this patient with local anesthetic, which is a very simple part of the procedure. And then we'll let her rest for just a few minutes and then we'll get started. All right, so now we're gonna go ahead and do the local injections. And so we're gonna do these injections. What we do at this point is we've done the injections and I just reinforce these marks a little bit. All right, so we'll let you relax for just a little bit. We'll come and prep the patient and then we'll do this here just in a few minutes.